After life school, I worked in the cashier's office in what was the old Dundee Royal Infirmary, and I always wondered what went on behind the screens and the medical side of things, and didn't really feel that maybe I had the stamina or the capabilities to be a nurse. However, I did apply to do my nurse's training. That was back in 1977, and I've been doing that ever since. I think nursing's not so much a job as it's a passion. There's not a day where I leave the building and think, I really haven't enjoyed my day. It's probably been very stressful. We have a lot of challenging behaviour at times as well. But when you walk out the door at night, you do have a feeling that you've done well and that you've made a difference.
They looked after me as well as looking after Sheila, because you can understand losing we've been together 56 years. And then snap, it goes like that. When she was at home, anger was the thing. Angry all the time. She was in here 2 weeks, complete change. She started laughing, smiling all the time. You can see it in the residents' faces. They brighten up when she's there, when she's speaking to them.
Life changes for everybody, but it changes for the relative as well, and their life is no longer as it was. So you have to try and still keep these people as a couple, as a loving couple, and have life as normal for them as it possibly can be. I've worked here a long time. I've been here for 15 years, and a lot of the residents are still here. They've been here all that time with me as well. It's about getting to know the person. You can't just see that person coming in the door as somebody old who's had a stroke. It's not a name and a diagnosis. It's a person that's had a life. They've lived through wars, they've lived through so many experiences, and we can learn so much from them. You have to have stamina, you have to have compassion, you have to really, really want to do the job. And I think that's why us older nurses still like to be on the floor, doing hands-on care. Yeah, the paperwork gets done, but often we stay on later to do that because we like to be involved. You can't write about people, you can't do care plans for people, you can't personalise their care if you're not actually working hands-on with them. And if you just always have the ethos that, you treat the people that you're looking after, if you treat them the way you would want your mum or dad to be treated, then, that's the best that you can do for them.